about security. Emergency response for all. Ladies and gentlemen, welcome to the class of Emergency Response Training course. I am the main teacher of this course, Miss Yamming. The onboard Universal Precaution Kit is an important line of defense for passengers to provide safe flight travel. It contains a variety of necessary protection and emergency materials. It can help us act quickly and effectively in the event of a public health emergency on board. Usage of sanitation and Universal Precaution Kit. Universal Precaution Kit. It is used to clean and eliminate potential infectious sources, such as blood, urine, vomit and excreta in the cabin, and provide personal protection when caring for patients suspected of being infected. The number of Universal Precaution Kits provided for each aircraft and passenger flight shall not be less than one for every 100 passenger seats. The allocation of Universal Precaution Kit shall be appropriately increased for the aircraft flying in epidemic areas. Name and purpose of medical supplies in the Universal Precaution Kit. Liquid and excreta disinfection coagulant. It has the characteristics of fast water absorption and gelation, and has an inhibitory effect on common pathogens, but has no obvious corrosion and toxic side effects on the cabin. Surface cleaning and disinfection tablets. Tablets used as disinfectant for the preliminary disinfection of dirt surfaces and contaminated ground. The disinfection effect has high efficiency, and there is no obvious corrosion and toxic side effects on the cabin. Skin disinfection wipe. Kill common pathogens. No irritation to the skin. Medical masks and eye masks. Shielding effect and anti-fog function. Anti-penetration rubber, plastic, apron. Medical protective clothing material. Length up to the knee. Can effectively prevent the penetration of blood, water, oil, acid, alkali and salt solution, and other permeable substances. Large absorbent paper, wool, towel, polypropylene polymer absorbent material. The size is 20 cm x 20 cm. Each piece of absorbent paper towel absorbs at least 100 milliliters liquid. Portable pickup shovel. With shovel, scraping, pickup function. Special garbage bag for biological harmful substances. The material is medical garbage bag material. Specification 2.5 silk, the color is yellow. Printed with warning signs. The garbage bag should be a Chinese label. The content of the Chinese label should include the airline name, flight number, date of production, garbage category, operator, etc. The user must be trained in relevant disinfection and isolation knowledge, disinfection device operation, and have personal self-protection ability or corresponding professional qualification only during aircraft flight. In case of public health emergency, suspected or confirmed source of infection, the cabin steward shall be responsible for opening it. In the conditional cases, apply guidance to professionals as far as possible, and avoid secondary infection. The disinfection and epidemic prevention work of the aircraft after landing shall be handed over to the ground health and epidemic prevention departments. The articles and drugs in the bag shall be used strictly in accordance with the instructions for using. Before using the medical supplies and drugs in the kit, the user shall fill in the informed consent form for use of emergency medical equipment and drugs, and the purser or professional may be responsible for guiding the use. Operation of Universal Precaution Kit equipment. Let's take a look at how to check and operate. Pre-flight inspection. Whether it is in the specified position, the seal is intact, whether it is within the validity period. Usage method. Wear personal protective equipment. Wear medical masks, eye masks, medical rubber gloves, and anti-penetration aprons in turn. Prepara disinfectan. Take a surface cleaning and disinfection tablet and put it into 250-500 milliliters clean water to prepare a disinfectant with a concentration of 1 to 501 to 1000, which is used for preliminary disinfection of the surfaces and floors of objects in the cockpit contaminated by dirt. Evenly cover liquid, excrement and other dirt for 3-5 minutes to make the gel solidify. Use a portable pickup shovel. To scoop the gel solidified dirt into a special garbage bag. For biological hazards, disinfect the contaminated items and areas twice with absorbent paper towel soaked in disinfectant. Ensure that the disinfectant stays on the surface for 5 minutes each time, and then wipe and clean twice with water. Finally, the absorbent paper towel and all other used disinfection supplies are put into the special garbage bag for biological harmful substances. After hand cleaning and disinfection, take off aprons and gloves in turn, and wipe hands with tissue for skin disinfection. Then take off the eye mask and mask in turn, and finally wipe the hands and other parts of the body that may come into contact with the dirt. With the skin disinfection wipe tissue, put all the used protective equipment into the special biological harmful garbage bag. Seal the garbage bag. Fill in the biological harmful garbage label, and paste it on the seal of the garbage bag. The sealed garbage bags for biological harmful substances are temporarily stored in the toilet and locked to avoid loss, damage, or contamination of in-flight meals before landing. The cabin manager, PERS, shall inform the AOC of the use of the Universal Precaution Kit through the cockpit, and the AOC shall inform relevant ground units to supplement the Universal Precaution Kit and notify relevant ground departments at the destination. To prepare for receipt, the cabin manager, purser, fills in the Emergency Medical Incident Report form and submits it to the flight medical room within 24 hours after departure. Precautions. Before treatment. Take all kinds of protective measures. Treatment. Strictly follow the operating procedures to prevent the disinfectant from entering the eyes or being contaminated on the skin. If the disinfectant enters the eyes or is contaminated on the skin, do it with clean water immediately after treatment. The treated articles shall be put into special garbage bags for biological hazards and sealed for subsequent treatment. The medicine and instrument in the Universal Precaution Kit shall be disposable and shall not be reused after use. After using the Universal Precaution Kit, it shall be disposed according to the procedure in Item 9 of Article 3, or the airworthiness of the aircraft will be affected. Flight safety is more important than everything. Keep the emergency equipment in mind. Universal Precaution Kit is used to remove potential infectious sources, such as blood, urine, vomit, and excreta in the cabin, and for personal protection of cabin crew members when caring for patients suspected of being infected. Okay, that's all for this class. I'm Miss Meng Meng. See you next class.